That's a good question, Wambui. Let me go back before
pre-pandemic.
COVID.
Yes.
Yeah. In fact, we had targeted ourselves to support about 2,000 people. To be precise, 2,200. But from March up to December, we supported over 5,000 people. Out of those, we got 3,000 women and girls violated, right? 700 women and girls suffered sexual violence. We also have what we call psychological torture, which actually, which was really on the rise this particular time. Why? Because perpetrators were now at home with their wives, with the victims, with their children. Schools have closed.
Survivors, please. They are called survivors.
Not victims.
Not victims.
We apologize and withdraw. Survivors.
Yes, with survivors. Yeah, before they became survivors, they were at home with their perpetrators, who then, because of arguments in the house, disagreements over either food, there's nothing for children, and the guy is not working, or rather the husband is not working, the wife is not working, they're all there. So out of that argument, you find they're beginning to fight. Children begin to fight their parents. So it became, everything became loose.
Yes.
And that is the reason why we got so many of those cases. Children were left, some were left unattended. So they would go to the neighbors to ask for food. And what happens? They're defiant.
Violence.
Right? The ugliest case we got, and this you wouldn't want even to hear, was of an infant, 4 days old, by a stepfather. 4 days. And it was not just that infant, even the brother who was 3 years old was defiled. The mother stepped out very briefly, and it happened within a second.
4 days.
Yes. We received very ugly cases. And this was the worst moment during this COVID period. And it's still going on. Last night alone, we've received over 200 calls. People asking if it happens to me. Others, it has already happened and they need some telephonic counseling. And that is why 1195 number, which is a toll-free line, comes in handy for our women and girls. We have a team that is working round the clock, right? So from January, we have handled over 3,000 cases. This is
January of this year.
This year, right? And you know, it keeps on varying. It depends on who is doing what, like what we're here, and we're talking about the helpline. People are already calling. Kenyans need to be reminded about this great service. Yesterday, while we got enormous numbers, and our team on night shift really got very exhausted, just because someone went to studio and media did a good job, and they publicized the number, and we got lots of cases.
Yes.
So, for me, if you ask me, are we about to end GBV? Are these cases coming down? You can see from 2019, we targeted, or rather we projected 2,200 cases. We ended up getting over 5,000 cases. This year, we still have COVID, and we already have above 3,000 cases up to this morning. Which means we are not learning lessons. In as much as we are being helped by the public to even report these cases, because this is the first people will let us know what is happening.
Yes.
And the beauty of the number is now breaking the silence amongst the target groups, who